Good day, good morning, good afternoon, good evening. It's Dr. Unat, your host. Today I want us to talk about an exciting topic, rubella. Rubella is quite an interesting topic because it affects anyone worldwide. But we do have countries that are more prone to it, or continents that are more prone to it, like Southeast Asia, those countries there, or Africa, our African continent, right? And reason being lack of immunizations. It's fortunately it is a preventable disease, so it's basically possible to prevent yourself from getting one. Okay, so it's not gonna take too long, guys. Definitely less than 10 minutes. Rubella, what is it? Basically, you get rubella from getting droplets, air droplets from the air, or someone coughed and they just go right to your nasopharynx, right to your nasal passage, and then that's how you breathe it into your system. Okay, so it's basically from air droplets, respiratory droplets. Basically, someone coughed and then you get infected. So it affects women, and because I'm going to talk more about the complications. So what happens is when you get rubella, you get infected from these air droplets. And then how do you present? You actually have 3 weeks of getting the symptoms. Say that's the incubation period. After getting infected, okay, you basically inhale these droplets. It takes 3 weeks to get symptoms showing. And sometimes, because of the symptoms that appear after getting it, like a rash, that one is highly virulent, which means if you get the rash appearing 1 to 5 days, you get really sick and you are highly infective. So if you have any rash, you don't understand, go see your doctor immediately. So what are the symptoms? The rash, I mentioned that. You could have conjunctivitis, like infection of your eyes. You could also have high fever. Sometimes it goes 39 or even low fever, like 38. Some people, they even get seizures from this high fever, right? But it's not common. Very painful joints, we call it arthralgia. So who is at risk? Obviously, I mentioned it's people who lack immunizations. I'm glad that in the African continent now, countries are aware of it. They are immunizing. Rubella comes with combination immunization. It comes with measles, mumps, of course, rubella and varicella. Sometimes it comes in just measles, mumps, and rubella. These are all viral infections, and it's given in this needle form. Who gets it? When we are born, when we hit 1 year old, or 1 year or 15 months, we need to get this. So one needs that. One single dose is good, but of course, when you're getting your MMR, meaning measles, mumps, rubella, or MMRV, measles, mumps, rubella, and varicella, which would prevent you from getting chicken pox or shingles in future. So that is another topic. So basically, you get it at 1 year, and a lot of people, they do well, more especially for over 20 years. Sometimes you need a booster. I'm going to emphasize this. If you are a childbearing age, meaning any woman has basically high risk of getting rubella and infecting the unborn baby. So it's always important when you're planning pregnancy, go see your doctor. Ask your doctor to check, or your nurse to check your immunity status. Check, you know what? I believe I was immunized as a child. Can you please check my rubella status? So we do blood tests. We say it's titer. If you're good, then you're good to go. Then you don't have a risk in your pregnancy, right, of infecting your baby. And remember, I said it's a viral infection. You get it from the air droplets. Someone coughs or it's in the air. You caught it. That's how you get infected. And it takes up to 3 weeks to get sometimes the symptoms going. But once the rash comes out, after getting infected, 1 to 5 days, you are highly infective. You could infect other people around you. Okay, so what happens with this infection is people, once, let's say, a pregnant woman gets it, the unfortunate thing is it's a live vaccination, we can't give live vaccinations in pregnancy. So the risk would be high for something we call congenital rubella syndrome, which means your child would have the transmission of rubella into his system, high risk actually of stillbirths, miscarriages. You could get miscarriage, or if the baby survives, the baby could develop cataracts, like the eyes are hazy, can't see. There's high risk of autism, right? High risk of learning disabilities, right? There's high risk of encephalitis, meaning infection of all the brain layers, right? It's quite dangerous, guys. That's why we call it congenital rubella syndrome. So if you are planning pregnancy, key thing, if you're planning pregnancy, go see your doctor or your nurse to say, hey, please check my rubella status. Check my blood test if I'm still immune. If you're not, go for immunization before falling pregnant, because immunization is not given in pregnancy. We give it immediately after you give birth. But we want to prevent this infection from infecting your baby and have all these complications. I forgot to mention that there's also brain damage complications and brain defects. Just basically the fetal defects, guys. Even the heart gets affected. Okay, so they're quite serious complications. You don't want to have a child that has high risk of autism, learning disabilities, heart problems. We already have countries that have no access to healthcare, or some people that live in the villages. So it's something that we can prevent. Okay, so it's self-limiting. If you get it in an adult stage, you basically treat symptoms. If you have fever, you would stay hydrated too, right? As you have fever, you are perspiring, so you don't want to lose fluids, right? So make sure you stay hydrated. You give yourself Panadol or Tylenol, depending on the country. Basically, it's acetaminophen or Panadol in Africa. In Canada, we call it Tylenol, right? So you basically take that to reduce your fever, but make sure you go for immunization. Okay, some people, they need another booster. Like I said, this is good for 20 years. So if you are here, or you have a wife or your sister or yourself, you know for sure that you plan to have kids, go make sure that your immunization is up to date, so that you know that you are given immunization against your rubella. You know that when you're pregnant, you don't have high risk of a child developing all these conditions I mentioned. And I forgot to mention, your baby could also have a risk of developing diabetes and also thyroid disease. It affects a lot of organs, right? So in closure, go check your status. And if you develop any fever of unknown origin or rash, glands swollen just behind your ears or behind your neck, go see your doctor immediately. Okay, it is a preventable disease. You just need to do what you need to do. I'm quite proud actually of Uganda. They were doing a good, nice, big campaign. Women were getting immunized against rubella. So it's preventable. Save your life, save your child, because dealing with the complications is more expensive. As we all know, we have issues with disability. Who is going to look after your child at schools? Because a lot of schools, if your child has severe autism, it's difficult for those kids to fit into schools and the programs that they need to be under. So this is a preventable condition. You don't want to have a child that has all these congenital malformations because of poor prevention or lack of immunization. It's preventable. Do it. And when you get immunized, you could get fever, you could get a rash or just pain on the local area where you had immunization. Honestly, it doesn't take long, right? If you have high fever, I always advise my patients, or when I take my own kids, when I take them for immunization, I always make sure I give them Panadol before they get those shots, so that their temperature is kept at bay. So in closure, get immunized. It has no complications that are major. Like I said, it's just pain on the local area you were immunized on, or just fever. So prevention is better than cure, as we all know that. I'll see you on Monday. Drop topics that you want us to discuss for next week. We're dropping any topic. There's no stupid question in our group. Drop any topic. There was a suggestion on bipolar and personality disorder. I think it's a fantastic topic. You guys, you can vote on that. I'm okay with it. So next week on Monday, I'll see you. Thank you.